I'm Dr. Ray Moharis at Perpetual Motion Physical Therapy in Marietta. I'm here today to talk about the AlterG. It's an anti-gravity treadmill. It's specific for lower extremity pathologies, for like foot fractures, ACL reconstructions, total knee replacement, just weird gait stuff. It could take anywhere from about 0 to 80% off your body weight. So think of it as kind of the weight to strength ratio. The less you weigh, and if your strength isn't modified or augmented, you're that much more powerful. So we can work on a lot of dynamic things. We can perform a gait analysis and actually see at real pace time your sub 5, your sub 5.5, your sub 4 miles on the machine to see what type of gait deviations you may have and slowly correct them. Not abruptly, but enough to go ahead and make sure that pain is not part of the equation when you run. You see, when you have pain, it decreases your activity or your ability to perform at that high level. An athlete will consistently look or think about the pain that's going to be generated subconsciously, so inadvertently they can not put pressure on different parts of their foot, maybe decrease your stride length, or maybe just not push as hard because of the pain that's going to be perceived from that activity. When you're rehabbing, our primary goal is to decrease or eliminate pain altogether. We feel that we have specific protocols in place to accomplish just that. There's 4 sensors on the machine. When you're placed in there, we're going to get one of the volunteers to get in here, and we'll go and show you how that works. The sensors are analyzing your weight at any given time. Once you're sealed up, so the calibration process will go ahead and determine how much area it would take to go ahead and take at least 80% off your body weight. At that time, we can go ahead and be very specific. It's not like an aquatic program or in a pool where you're guesstimating how much pressure you're putting on your body. We can be very specific. So if a surgeon wants 50% off your body weight, we can actually take 50%. Or if we can go ahead and to progress to 65 to 85, whatever that may be, to go ahead and make the progress or the performance level that much higher and not augment too many things as far as your gait or how fast or what things that needs to happen during that type of activity. I know that doesn't make sense right now, but once we place that individual in here, we can go ahead and kind of tweak it and show you exactly what the machine does afterwards. We're about to go ahead and place Calvin on the machine. Very simply, we're going to go ahead and bring this cockpit down. We're going to ask the gentleman to go ahead and step on board. Okay. So you can see the patient's on board, firmly secured. This time we're going to ask the patient not to move around. It confuses the sensors and we have to go and repeat the process. So Calvin, I'd like you not to go ahead and move around, okay? Okay.
The AlterG is now set at 70% of Calvin's body weight. We're now going to increase the speed to 6.0 miles per hour, a 10-minute pace. It takes a little bit of time for the computer to calibrate data for gait analysis. The numbers on the top left corner of the inner screen by the feet illustrations indicate body weight percentage of the left side versus the right side. Now, by the computer's calculation, Calvin appears to be right foot dominant at 51% on the right versus 49% on the left. Another great piece of data is step length. The numbers on the bottom of the leg illustrations indicate right side and left side step length. Calvin appears to have a deviation of about 5 to 6 inches, which is pretty substantial. Now, another discrepancy we see here is the stance time, in which we see anywhere between 20 to 30 milliseconds. For most of your athletes, cross country, track, any type of sprinters we see on board such as football, we want to see symmetry. We want to see symmetrical utilization of both legs. When we see deviations like this calls for intervention. We want to go ahead and make sure these numbers are as clean as can be, as symmetrical as we possibly can. The more symmetry we see here, the more powerful this individual is. Now, asymmetry may be an issue with pain, this may be an issue with tightness, it may be an issue with a lot of different factors. And that's what we see here, and that's what we would try and correct.
Hi again. So the gait evaluation that's done, there's no eyeballing anything. It's precise. The calculation that's done through the machine, it's done within milliseconds, and it's done within inches, and it's done within real time. So it's a proper gait analysis of what's going on with you, along with the visual inspections and the video that we shoot to let the runner and the athlete understand what they're doing. It would help them to understand exactly, proprioceptively speaking, what they're doing in space. And when they're aware of specific issues with their gait, they can change them out to be a lot more dynamic, be it from a pain to decrease in pain or an increase in performance, or a combination of both. Here at Perpetual Motion Physical Therapy, we are at the forefront of technology, and we're here to help you. If you have any questions, feel free to go ahead and give me a call, or you can go ahead and message me via my website. Thanks, and have a good day.